Are you suffering from chronic symptoms, fatigue, brain fog, aches and pains, sleeplessness, bathroom issues, and you've been to various doctors and they tell you have different diseases like chronic fatigue syndrome or fibromyalgia, and you're looking for answers? Well, the answer may be right here. You may be suffering from chronic inflammatory response syndrome, also known as mold or biotoxin illness. Hi, my name is Dr. Michael Rothman, and I'm a specialist in holistic medicine. I've been practicing holistic medicine for over 20 years, and I have much experience treating patients that are suffering from chronic inflammation. I have no conflict of interest, and this information is provided only for educational purposes. This is not a substitute for professional personal medical advice. So, what are the symptoms of chronic inflammatory response syndrome? Well, they could literally be anything: fatigue, low energy, digestive issues, respiratory issues, neurological issues. So, what's happening here? These symptoms are being caused by chronic inflammation. Inflammation in your brain can cause brain fog, tremors, mood issues, and other neurological symptoms. Inflammation in your muscles and connective tissue can cause pain and stiffness. You could have inflammation in the energy producing organelles in your body known as mitochondria. This can lead to fatigue and eventually organ dysfunction. The bottom line is inflammation can contribute to any of diseases or symptoms that you're having. The question becomes, what is causing my chronic inflammation? Well, very frequently, this is being caused, your symptoms are being caused by the exposure to a water damaged building. This is incredibly common and very much under-recognized. So in a water damaged building, you can have mold growth. You could have the production of volatile organic compounds and other toxic organisms. And these substances are known as inflammagens. And inflammagens are the root cause of many, many chronic degenerative diseases. Inflammagen exposure activates your immune system. Your immune system then causes activation, which leads to what's often referred to as an autoimmune response. And then this autoimmune response leads to inflammation, organ dysfunction, hormonal and metabolic imbalances. So the root cause here are what are known as biotoxins or biological toxins, toxins caused by living organisms. And these living organisms excrete these toxins to protect themselves from you. But when they do this, they injure you. And common sources of biotoxins are water damaged buildings, algae blooms, insect bites, animal bites. And these biotoxins can produce immune-mediated inflammatory effects and also direct toxic effects. Well, how would you know if you have a biotoxin illness? The diagnosis can be elusive, but by looking at your history of exposures, have you been working or living in a water-damaged building? Do you smell mildew? Do you see water stains? Your pattern of symptoms can also be illustrative of having biotoxin illness. These symptoms tend to be bizarre. They seem to be unconnected. And if you go to your regular doctors, they may say that you have a psychiatric illness because no one could have all these symptoms all at the same time. There's no one illness, they'll say, that explains all this, but there is. And that illness is known as chronic inflammatory response syndrome. There's also genetic susceptibility to this. So genetic testing can be useful. Only 24% of the people have this gene. We can also measure markers of inflammation in your body, showing that your immune system has been hyperactivated. And also there'd be evidence of hypothalamic dysfunction as a result of this chronic stress. We can also look for evidence of mycotoxins, antibodies in your urine, in your serum, and also direct measurement of mycotoxins in your urine as well. We must pay great tribute to Dr. Ritchie Shoemaker, who has discovered this and was the first doctor to connect the dots between mold exposure and chronic inflammation. Dr. Shoemaker is a pioneer in this field. I did train with Dr. Shoemaker starting in 2016. There are many barriers to recognizing that you do have this CIRS, C-I-R-S, chronic inflammatory response syndrome. Most doctors, most people in the health field are not aware of this. There are many practitioners in the alternate field that are aware. But there is a significant genetic component. Only about 24% of the population has susceptible genes. So imagine you're working in a workspace and there's 12 people in your office and 3 of them are sick and the other 9 are fine. Those 9 people would say, well, it can't be the workplace because we're fine. You 3, you're just malingerers. There's something wrong with you. And there is something wrong. They have the genes that make him susceptible. Another confounding influence is that so many spaces are damaged that you could be working in a damaged, water damaged building, driving a water damaged car, living in a water damaged space, and just being exposed all the time. So when you go from environment to environment, you don't notice the difference between your environments. If you were to go to work, for example, and that was the only environment you were being exposed to mold and you had headaches only at work, then it would become pretty obvious. But if you have headaches pretty much everywhere you go, then that wouldn't be a good clue. Another confounding influence is that even previous mold exposure, years or even decades in the past, can contribute to current illness through mycotoxins that are trapped in your system or colonization within certain areas of your body, which are producing mycotoxins internally. So here's my brief mycotoxin story, or my mold story. I'm standing in front of this barn door in 2016. About 1 month after I finished my certification with Dr. Shoemaker, I walked into this barn doing a spring cleanup and was exposed to large amounts of mold. And 3 days later, I came down with shingles. It was very painful. I had blisters under my right armpit. I also felt lousy. I had headaches and fatigue and brain fog. But the worst symptom of all was anxiety. The anxiety was debilitating. And the lesions went away after several weeks, but the other symptoms, including the anxiety, got worse and worse and worse. And then one day I was in my kitchen and I realized, or thought to myself, is my house contaminated? Because I had not been back in that barn. And then I did an experiment. I went outside and spent quite a bit of time outdoors, and I felt significantly better. And then when I went back in the house, I felt my symptoms come back with a vengeance. It's very shocking because I really hadn't noticed this pattern. And so then we did have the house tested. We did have mold growing in many places, in the basement, in the HVAC system, in the attic, in the dining room ceiling, in front of the dishwasher, in front of our front load washing machine. It was literally everywhere in our house, but we didn't see it or smell it. And then over the next few months, I did have my house remediated and my health improved fairly quickly. But then I realized that my office was also contaminated. This is an office in Spring Lake, which we have since left. I didn't test that office. All I needed to do was walk in there and the anxiety would come back almost immediately. I then realized my car was contaminated. My dentist's office, my accountant's office, my lawyer's office, all contaminated with mold in many of my friends' homes. So since then, I've avoided mold. And now I realize in retrospect that my diagnosis of Crohn's disease at age 19, a so-called autoimmune disease, a so-called incurable disease, was actually caused to a great deal by mold exposure. I know this because if I get exposed to mold now, those symptoms will recur. So what do you do if you've been diagnosed or you suspect that you have chronic inflammatory response syndrome? Well, the first thing you need to do is get out of the exposure. So this very simple analogy is a pretty good explanation here, almost like a bathtub. So when you fill up a bathtub, you have the faucet is on, and then the water accumulates, and then the water needs to leave through the drain. But if your drain is clogged and the faucet's on, then you will accumulate water, or in this case, toxins. And when those toxins reach a certain threshold, they will spill over and start to cause inflammation in your body. And then this inflammation manifests with all these bizarre and various symptoms. So the first thing you need to do is remove yourself from the exposure. Turn off the faucet. That may mean that you need to have your house remediated, or for some people, they really need to just move or sell their car or change their job or whatever it may be. But turning off the faucet, removing from exposure, is vital to your recovery. Another step, the next step, would be to try to unclog the drain. So mycotoxins can stay in your body, and we need to get rid of them by using your liver to detoxify you. And your liver will concentrate these toxins into your bile. And then we can use things called bile resin binders to help literally unclog your drain and to pull these mycotoxins out of your body. And then once your body's clean of these toxins, these biological toxins, the inflammatory signal can stop. Now, in addition to the inflammation, uh, toxins from mold also produce things known as mycotoxins. These toxins also contribute to toxicity in another mechanism other than inflammation. These mycotoxins can move anywhere throughout your body. They can be inhaled, they can be absorbed through your skin, they can get into your brain. And mold species can produce various forms of mycotoxins. So let's say that you've removed the mycotoxins from your system, the biological toxins through binders and other methodologies you've moved, but you still don't feel well. Well, maybe something else is going on. And that something else could be the chronic stress distorting your body chemistry. As your body is subjected to chronic stress and attempts to defend itself from this stress, you will activate certain defense mechanisms and you will overutilize vital reserves of nutrients. And this can lead to their own symptoms. So therefore, even if you've been removed from the mold and detoxed inflammagens, you can be left with residual metabolic, hormonal, and nutritional disturbances. And this is where metabolic and functional therapies can be employed to restore your normal metabolic, hormonal, and nutritional balance. To make matters even more complicated, unfortunately, there can be other things causing problems with you chronically. So the exposure to mold, distortions in your body chemistry leads to a little Pandora's box of other things that can affect you. Fungal overgrowth, yeast infections, small intestinal fungal overgrowth, known as SIFO, something called dysbiosis, and small intestinal bowel overgrowth, known as SIBO. You could have imbalances in your bowel flora. You could have growth of H. pylori. You could have parasites growing, exposure to heavy metals. Many people are suffering, in addition to mold exposure, stealth infections. Lyme disease, Bartonella, Babesia, Mycoplasma, chlamydia, and many others can hide in your body, and you can have these your whole life. And when exposed to mold, activate these dormant infections. Exposure to electromagnetic frequencies, known as EMFs, can also add stress to your system and contribute to your own wellness. And lastly, just this chronic stress in your body can impair your limbic functioning. Your body you start to become your own enemy, where you live in a constant state of fear, and that fear response can actually cause inflammation all by itself. So are you ready to take control of your health? I would recommend that you schedule a free 15-minute consultation with me. People go from doctor to doctor, and they rule this out, rule that out, and they've have all these different diagnoses, whether it's leaky gut syndrome or mast cell activation or chronic fatigue syndrome or fibromyalgia. The diagnosis is not going to help you. Treating your symptoms is not going to help you. Only by getting to the root cause will you get and be able to obtain a complete resolution of your symptoms and perfect health.